Hello, everyone, and welcome to this COVID-safe legal compliance webinar that Kaizen Synergy Law Firm is running. I'd like to welcome you all to today's session. Just a couple of housekeeping things straight up. This is session of five that we have been running over the past few weeks. We are actually extending these sessions due to the demand and requests from agencies all around the country, which will specifically focus on the next series starting next week, the same time, on the COVID safe operational aspects around your COVID safe legal compliance plans. And I'll say more about that during the session today. Today's session is going to focus on the reporting, surveillance, and monitoring of your COVID safe plans. It will bring and join a lot of the information that we have covered over the past few weeks, and I will be revisiting some of these today. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar and recorded, we do pay our respects to the traditional owners accordingly. So today's session will focus on looking and revisiting the COVID safe plan that you all have access to, along with the Gemba 360 dashboard, in terms of the surveillance, the monitoring, and the reporting of this. This is going to be particularly important when we look at the staff activities and build upon some of the works that your agency should be looking at as part of this process. We will be covering off some of the governance obligations, the work health and safety rules and requirements, and duties of directors and officers of your respective agencies, and also looking at some of the more compliance-based requirements for yourselves. But we will be specifically focusing on some of the reporting, the surveillance and monitoring, in order to ensure that your staff are kept safe, or your personnel, should I say, are kept safe, because staff, meaning volunteers, plus also the people that you may employ, your contractors as well too, are providing and receiving safe work practices within this COVID environment that we are living in at the moment. So this week we are going to be looking at the reporting, monitoring, and surveillance, and using some of the tools that we've discussed over the past few weeks as well too. This will look at the plan briefly. This will look at some of the policy documents as well too, the pandemic forms as well, and just revisiting the areas and items that we'll build on over the past few weeks as well. As I've mentioned, throughout the month of October, we will be taking these webinar series and extending them as well too, to include and cover the core operational activities of your COVID safe plan. So now that you've got your plan in place, you've got your policy documents, you've got your pandemic forms, really what is the next step, and how do you then operate the activities within your COVID safe plans to make sure that you meet all your legal compliance obligations? In that, what we are going to be doing is actually using case examples over the next few weeks. These will cover things like AGM activities that you're obviously needing to organize if you haven't already. This will include some of the governance practices as well too. This will include also how you deliver services to clients that you have, whether you're an essential service agency or an agency that is opening back up post lockdown. I know that this applies to many agencies, obviously in Victoria, but also those agencies in New South Wales and Queensland and WA as well too, who have been, I'm going to say, dormant for the past short while, but then now looking to open up and slowly open their services as well too. So we are going to be covering off a lot of the operational activities, and really, I'm going to say the hands-on workshop type approach as well too. So we will be covering those for the month of October. With this session, by attending this webinar, you will get a timely collection of resources that provide an overview of information that may be helpful to support your company, clients, and also clients you provide direct services to. You can see what COVIDSafe systems and activities other companies that have been doing, what they've been doing that is actually working and helping them to grow and operate during this crisis. And this will be extended, as I mentioned, throughout the month of October as well too, due to the sheer volume of requests that we have been asked to look at and support agencies, which our law firm Kaizen Synergy is quite happy to do as well too. And you'll also see case examples of what has worked and what continues to work as well too. So these sessions moving forward certainly will be hands-on as well too. A few housekeeping items, as always. You can ask questions in the chat bar as well too on your session, and we will monitor these throughout the session. So if you'd like to ask any questions as we go through, you can certainly do that. This webinar will be published on the Gemba 360 YouTube channel, and all materials referred to will be circulated, including these slides as well too. We do have a knowledge base that is open as well too, and you can view that on our website. And with that, it is something that is certainly available to all agencies to do, and you can actually view that directly, and we will post all the materials up there. You can view our website by simply going to this website here, kaizensynergy.com, and clicking on this link, COVID-19 knowledge base, and that actually has listings of all our previous information as well too, and information that you can watch and see there. With that said, also, if you do have any questions, many of you have raised a number of legal questions, be that around employment issues or challenges, whether that be around JobKeeper, raised around constitutional questions and rule book questions as well too, and also obviously around the COVIDSafe works as well. By all means, contact us. My mobile number is listed here along with our direct line and also email address, and you've got a number of channels to access that information and get any questions that you want answered to us. So let's just go through around the monitoring, surveillance, and reporting for your COVIDSafe plans and works. So we are going to tie up a lot of the discussions we have had over the past few weeks and webinar series. So with it, the COVIDSafe plan, going back to core basics, is really meant to do 4 key things, and you'll see this being repeated in some shape or form by all different premiers and the Prime Minister across the country as well. And they talk about the COVIDSafe plan is to ensure that staff are kept safe, community and services are supported, and services continue to be delivered. It needs to address the changing service of your business as well too, and ensuring access support continues to deliver services as well too. What we have covered off also, and what we have said over the past few weeks, is that in addition to these, the COVIDSafe plan should also ensure that your company meets its legal compliance obligations, whether that be under work health and safety, public health laws, privacy laws, fair work laws, just to name a few. And there is already talks of class action against some private aged care facilities, judicial inquiries into government management of the hotel quarantine system down in Victoria. And there's already talks of quite significant class actions against not only governments, there's private operators and the likes. So when we talk of the COVIDSafe plan and the legal compliance aspects, one of the important fifth elements that I'm going to say has not been raised, and understandably why, from governments, is that it should be a not just a public response to COVID-19, but also to the management of your company. So, how we actually go about doing this around the surveillance of ensuring that your staff are kept safe, what is the reporting obligations to boards? This is really what we're going to look at today to ensure that you can actually keep on top of these obligations as well. So, obviously, why it is important is that COVID-19 will be with us for some time. So, it's important that your business has a plan and continues to plan to keep your workplace healthy, safe, and virus free. Across the country, since we've been running these webinars since February, March this year, we've seen changes by different premiers and states and territories. Some places are calling them steps in the plan. Some places some states like WA calling them phases. Queensland, New South Wales, and Victoria jump between stages and steps. But we've taken a step approach and definition, because effectively that's inconsistent with what the Commonwealth has done. But as things continue to change in each state and territory, your plan needs to be able to adapt as well too, in terms of how you meet these obligations. And there is a requirement around work health and safety that if you are a director of or officer of a company, you need to exercise due diligence to ensure that your employees comply with their duties and obligations. In relation to COVID-19, due diligence means you must acquire and keep your knowledge of COVID-19 situation up to date. Now, how people may do this is around following authoritative sources such as the Australian Government Department of Health, checking for daily updates to safety advice from the Chief Medical Officer and the likes. If advice is relevant to your workplace, quickly taking steps or the appropriate steps to help your employer implement it into the workplace, and also ensure that you understand your business and its WHS hazards and risks, including how COVID-19 could affect your workplace, the workers, and also make sure your workplace is properly resourced to manage work health and safety risks during the COVID-19 outbreak, and check that resources are also being used. So this is something that was taken some time ago from the Safe Work website. So there is an obligation on directors, which means your board of governance committee members, can be your CEO, managing or responsible officer, but also officers could include management teams as well too, and people in senior positions as well. So part of this was that when we've run these sessions, and a lot of agencies have approached us and said, "Look, we've started to use some of the varied templates that are actually out there from different state bodies." But then the problem becomes, once we complete those checklists and the likes, what do we actually do? How do we, in fact, ensure that our employees or our personnel are aware of what their obligations are? How do we ensure that they're kept safe to meet our minimum requirements? And quite openly, people are discussing, well, what is our minimum legal compliance obligations? And how do we ensure that we can quantify this as well too? And some of the tools and strategies that other agencies have done will actually show you in today's session. And keep in mind that these are actually working and continue to work as well. So two agencies I do really just want to focus on, and they are different in many respects as well too. The first is Rumballara Aboriginal Corporation or Cooperative, and I do acknowledge Laurie Seville, the Chief Operating Officer at Rumballara, who has agreed to allow us to share some of their information and dashboard details as well. And also Women's Housing Limited, and I recognise Judy Line the Chief Executive Officer there, and also acknowledge Lena Tompkinson as well too, the Executive Assistant and compliant, who has been undertaking the COVIDSafe compliance work at Women's Housing, respectively, as well. Now, as part of that, what these agencies have done and done very, very well around this is to continue to report and monitor and engage with staff around the surveillance and monitoring of COVID-19 within their respective agencies. And it's actually been done at a number of different levels, which I'll actually show you as well too. And the best way of showing you how the legal compliance obligations work, and not just from a theory side, is what has been done and how has it actually been done to meet the specific requirements. And this is not something that has just been started. This has actually been something that has been started from a number of months ago as well too. So within it, and we will cover some of these off, but just to revisit it, effectively the COVIDSafe plan is managed out of in Women's Housing is managed out of the disaster module. You will see that the pandemic forms run on the left-hand side, and these cover off some of the notifications that staff actually fill out or personnel actually complete. Sometimes they do these on a daily basis. Sometimes they do it on a weekly basis, which I'll come to as well too. They've also got policies that all staff are aware about to ensure that they've got their monitoring system in place and the surveillance of what needs to be done. They've got their registers around risk reporting, but also staff training as well too, that staff need to complete in order to demonstrate awareness, as well as the notice board area. So rather than centralizing a COVID-safe plan where one or two people might have access to it, these agencies actually open it up to improve their surveillance and monitoring of COVID-19 in terms of the services that are actually being delivered. Just so you know, Women's Housing has been working completely remotely for the last few months. And it was only yesterday that the CEO actually voyaged back into the office late yesterday afternoon. So with it, their staff have all been working remotely, but in saying that, they provide a diverse range of housing and health and well-being services. So when staff actually go and visit a client or need to do a site visit, then these staff are actually required to actually complete what we call a COVID daily assessment form. And part of that monitoring gives them the surveillance that they actually need to ensure that staff are kept safe. And I'll show you what that actually means. So let me just jump straight into, and you all have access to this dashboard that I'm about to jump to as well too. So within it, all of you have access to your dashboard. You'll find that you've got the COVID daily assessment form, and this is one of the main forms that we'll actually use in today's session. So with it, the daily assessment form, when you click on it, comes up and it has add new. It'll come up with the date, the name. I'm just opened up as Fred Flintstone, the date and the time that this has actually, or I'm actually logged in and completing it. What it does have is a series of questions, and these are based on the epidemiological questions that the relevant health department has sent through. And it asks you to actually ask the staff member, should I say, to complete this short survey around whether they have experienced any of these symptoms or the likes. And if they select no from all of this, then they're free to basically go through and actually visit clients or the likes. Now, if I go back and have a look at this as well too, and here's one that's been completed from marked as incomplete. Now, with it, the notifications will actually go to the line manager or yourselves as the admin. The idea is that if they select, let's say, no or yes from this as well, then an alert will effectively be prompted for the manager to actually check this out. And so with it, the COVID safe assessment form can change over time. And if they ever wanted to go back and actually have a look at these, then they can and actually see these over a significant duration of time of when they're actually required to complete these forms. So you can see as part of the COVID daily assessment form that in this case, Women's Housing have these forms in place to ensure that staff are kept safe and continue to deliver safe services to clients. If they display any symptoms, then there is a method of saying, well, no, you're not able to see clients. You actually need to either go get a test, a COVID assessment test done first, and also assess whether people can actually be safe enough to see a client as well. And in addition to that, what they've also done is updated their website to inform people about and their clients about what systems they have in place around it. You can see here that they've updated their website around it. It is about how they deliver services, what the assessment processes are, and also you can see some of their policies on their website as well too. So effectively, the opening up of the COVIDSafe plan is not just internally based within their agency itself. It's actually extended out to their clients and actually showing them what they're actually doing as well. So there is a greater awareness in terms of the monitoring and surveillance for their agency. Now, these particular tasks around each of these monitoring, reporting, and surveillance activities is pulled from right at the start. We've actually utilized the minimum Commonwealth, or at minimum, the Commonwealth directions, which identified the formal risk assessment process and hierarchy of appropriate controls. So these will be specific to your work and your own workplace and your own workers and personnel. But possible controls include, but the Commonwealth says are not limited to, about 14 different indicators. And these indicators have been continuously used right since March, since I believe February or March when they were released, and have continued to be used across different agency groups. So this includes ensuring that, for example, employers should have policies, procedures, and technology to support employees from working from home. Social distancing is supported, and also try to ensure 4 square meters per person and 1.5 meters between people wherever possible as well. Discouraging carpooling. And if we go to the next slide, thank you, then we're also looking at how you actually undertake frequent cleaning and disinfection and avoiding non-essential travel, etc. So these 14 criteria we've actually continued to use over the last few weeks of the session. But how do you in fact monitor and ensure that you have surveillance across all of this? This includes also ensuring that you educate staff on the early signs and symptoms. So that can be done in a number of ways. What we have seen that has worked incredibly well is actually looking at applying what we call a clinical governance framework over these particular indicators. And why we take clinical governance indicators is around something that the health and community services have been doing for many years now. But by doing this, we're actually looking at, well, how do we take the Commonwealth's criteria, looking at, well, what is the risk process? What's the clinical process? How do you actually identify staff and user experience around this to improve and meet your legal compliance obligations? And applying an accountability. So who's accountable in this to ensure that this works? How do you then bring in staff so that they can support this process? And the same thing has been done from Women's Housing to also Rumballara. Now, Rumballara is a unique agency, and when I say unique, they have a whole of life service delivery system. So they're an Aboriginal cooperative based in Shepparton in Victoria. And as part of that, they provide a diverse range of services. They employ some 200 to 300 odd staff or thereabouts. They're a very different agency where they provide a broad range of services from medical to justice to outreach to housing support services and the likes. But what they've got here is they've actually utilized the COVID-19 assessment form as well. And as part of the surveillance that they have in place, just to give you an idea, over the past few months, their staff have lodged just over 12,000 separate forms. So when I say that as part of that process, that form has actually continued to change ever so slightly over that period. I'll give you an example of that. Now, one of the things that obviously as the chief medical officer in Victoria had changed their position, whether that be on symptoms or epidemiology indicators or the likes of if there was protests that actually occurred where people may potentially, I think there's some 10 to 12,000 people may have attended a few months ago, and they wanted to actually screen staff to ensure, well, how do we know that our staff are kept safe? How do we know that they haven't been either come into close contact with other people with COVID-19 or have been possibly come into close contact with any other person with COVID-19? What is the measure of those obligations as well too? But if there was, how can we actually monitor that again? And again, what has actually stood up, and I'll say that has worked well, is around utilizing the same type of form. I won't show you the exact form that they use, but the form that we've actually had here, effectively when we bring this up, includes some of the indicators that they've actually utilized across the last few months. The process has been that once a staff member completes this, then a line manager goes in and checks this out. By doing that and confirms that their group or their team, I'm going to say, is COVID safe from day to day, has really given them the eyeline sight that their team, whether that be in the medical team, whether that be in aged care, whether that be in justice, is actually visible. If staff member has clicked yes, for example, and let me give you a good example of this, where somebody might have had a sore throat or actually said that they're increased tiredness. Now, in this case, where they've ticked yes, they've actually turned around and said, look, we've actually ticked yes, but I actually suffer from asthma, and my kids haven't slept properly for the past few weeks. Okay, so a note is being kept there. So they've got those, while they might have those symptoms, it's not actually related to COVID-19. So this way, they're actually having staff self-reporting around this as well. And staff can actually leave a note to say why they might have these symptoms, but it's not related to COVID-19. So you actually got this dashboard that allows you to manage your reporting very, very easily, very, very simply across this process. Equally, they've got to use the policies, and they've loaded some 6,000 odd policies across the dashboard as well too, which I'll come to, and also the utilization of the notice board. Now, this same platform and system around this was also used by a very different agency as well too. And an example of that was one of the migrant and refugee resource centers. They've just recently taken on the forms to actually be utilized, and with it, just in the past week or so, their staff have loaded in some 800 plus forms. Now, what they're able to do with this is it's not just about loading in the forms. from a work health and safety point, they can actually go back progressively and go, right, let's actually have a look at how we've actually met our work safe obligations. We can actually see that our staff haven't displayed any symptoms, not just for one day, but for progressive days as well too. And it means that as they're going through and actually having this set up, whether you're a volunteer, whether you're a staff personnel, it's actually extending this out. So you've got this register of forms that staff can actually, when I say staff, personnel are actually utilizing to manage their COVID-19 reports. And literally, as I've heard, it only takes literally a few seconds for staff to do. But by doing it, it is such a simple way of managing their surveillance of their staff. And it's been a really key monitoring and surveillance tool for staff to actually utilize. Now, as part of this, the monitoring that we're going to look at here is moving from the to also include your workplace audits. Now, as you, with a core component of your COVIDSafe plan is the return to work and working within your workplace itself. And we've seen this on this slide here. It's something that we've utilized in the past. And the COVIDSafe plans, when you jump in, has really been around looking at ensuring not only that your staff are kept safe, but also that your workplaces are also kept safe as well too. And one of the key forms that you need to have a look at is obviously the what can I do to keep my workers safe at the workplace and limit the spread of COVID-19. And the form that I'm referring to is this document here. And this is something that is directly from the Safe Work Australia website. And it's got a series of checklist tools that is actually quite good in terms of what people need to meet as well. Now, what we have found within this, if I jump to the dashboard around, well, how do you actually use this to monitor what's gone on within your agency and meet these obligations? Well, if you click on your disaster system here, which is in the middle of the screen, what will come up is the projects section here. And you can actually log in and actually view the individual COVIDSafe plan items. In it, what you do have, you can actually go through, and as I've said in the past, and I'll come back to the reporting around this, is that you have your individual reporting items here, and we can actually go in and see that. All of the reference documents that I'm talking about is actually located here. So if I wanted to have a look at the Safe Workplace checklist, I can simply click on this, and this resource is open to yourselves. And if I simply open this up, here it is here. Equally, if I wanted to have a look at the reference document, I was talking about information for employers from the Department of Health, then this is the previous reference document that I'm also talking about here as well. And you can see that it has the 14 or so reference information that we've also used within our slides. And this resource is available to you. But one of the agencies have actually asked us of saying, well, look, what has these other agencies done that actually works well? How do they actually monitor if we're talking about this section here? How do we actually monitor and ensure that we have appropriate surveillance of our workplace and our cleaning registers as well? So utilizing the Safe Work checklist, again, what you'll find on your dashboard is that you have what we call the SWA here. It's called Safe Work Australia. What can I do to keep my workers safe? And quite simply, what agencies have done is essentially kept these and asked either their maintenance or cleaning staff or the likes to complete either this form on the dashboard, Or alternatively, if I bring this side by side as well too, had this form be completed as part of a weekly or daily check, depending on the frequency you think you need to run your workplace on. So what we're doing here is joining the dots between what the regulators have in fact said versus what your agency needs to do, and also looking at what is the specific reporting and keeping of your legal compliance data sets to ensure that you can actually go back and actually have a look at the individual reports that your agency needs to look at as well. And that includes things like actually being able to actually go through and actually see, well, what do I actually need to do in terms of my surveillance? Can I, and the question really comes back to, can I actually go back over a week, over a month? How can I actually see that my staff have kept safe? Where are my documents to actually demonstrate that? The COVID daily assessment form that we've got on here allows you to do that. Places like Women's Housing, Rumbalara are really good examples of that. As I said, there's also other migrant resource centres that with that, when you look at the volume of data sets that they can actually go through almost on a daily basis and go, right, I can actually check all my staff every single day that they've worked over the past number of months, exactly where things are at, and actually show, well, look, this is the system in which we've been able to keep our staff safe. Equally, from a surveillance and monitoring point of view, your other forms, including your working from home, so that way you can see that, okay, what's my procedure around practical assessments for staff working from home? Do they have a safe work environment at home? Ergonomics, are those met? What are my workstation registers as well too? What's my cleaning registers around this? Can I then inform staff about what they need to actually do? So you can see when we look at these forms that you've got all these applications in place. And we're going to jump back to your dashboards around this as well too. Now, all of these parts of it is based, as I've mentioned, on the 3-step framework for a COVIDSafe Australia. And this is the document that Prime Minister Scott Morrison referred to. And with it, we've covered off in the past number of webinars, and just to revisit these here, that as the step 1, step 2, step 3 has been opened up, there is the references for workplaces to develop a COVIDSafe plan. Now, there has been a lot of information out there around this. There is information and posters and mobile apps and COVIDSafe roadmaps. All of this we've put together in your own COVIDSafe plan. But over the next upcoming weeks, we're actually going to put this into an operational framework to show you how this works. The plan structure, as I've mentioned in the past webinars, just to recap, and then we will open the phone lines to questions around this and looking at the reporting, is looking at your legal compliance obligations. So as the law changes, as new legislation is introduced at the Commonwealth or state government levels, as regulatory documents, and you can see too here under the on the bottom left-hand corner, we've shown you the checklist from Safe Work. We've looked at the checklist from the Department of Health and the Commonwealth Government. As new pandemic plans have come up, we particularly focus on Victoria as lockdown measures had to be recapped in Victoria. Agencies using their COVIDSafe plan have been able to respond quickly. Equally, when a state department asks you for your COVIDSafe plan around this, and we've seen agencies in Victoria do this, the question is, can you quite simply log in and produce it within a few minutes? Now, with it, your own COVIDSafe plan, you can access this by going to your disaster module, clicking on projects. You can work through each of the items that we've listed here. This is just one of our demonstration sites. And to actually either update it, you can click on open and go through those tasks that we went through last week. But if you wanted to run a report straight, if you're called in or audited by a state health department, you can simply click on this button here. And what comes up is your COVID safe plan. And it's as simple as that. What all this does is brings together your reporting of your activities that your personnel are doing. It runs your reports for your pandemic forms as well too, and it's run directly from your COVID safe plan. Now, as part of this, as you meet your legal compliance obligations and as these continue to change, your COVID safe plans will also be updated as well too. As I've mentioned, you do have access to this on your dashboard as well too. We have inputted these informations in. It does also include other areas for yourselves to also work through as well too. One of the things we will be doing over the next few weeks is providing you with informed checklists across your dashboard. So some of the areas covering governance around annual general meetings, around checklists for also around your policy requirements and system information. So guiding you through this process from an operational point of view will be what we're actually covering over the month of October. And that will be really workshop based. We will be actually sending information out a week in advance for attendees that are looking to join us as well too. And it is something that we will be updating. So with it, your COVID safe plans are there. We've covered off the reporting. We've covered off some of the surveillance. We've covered off the forms that are available to you to also use. As I stress, on your Gemba dashboards, you've got your regulatory body information, for example, from Safe Work and also Fair Work as well too. And you can update this directly as well. We have covered off some of the case examples as well too. We've looked at in the past how to update your staffing profiles as well too and personnel. So as part of this, our recommendations coming out of today to look at the surveillance and monitoring of your COVID safe plans for your agency is to look at loading your staff and personnel into the Gemba dashboard. You do have access to your COVID-19 forms. You can also, some agencies have been snowed under with a lot of playing catch up with other areas. So they have actually reached out to us to get assistance in reviewing their plan as well too, and also rolling out policies as well. With this, you also do have access to your COVID safe dashboard. You can commence working on this. We have, as we've mentioned in all of our webinars, there is a single license that we've opened up that's available to your agency to in fact use. But if you obviously want to extend this out to all your staff, volunteers, clients, and other personnel, then there is a small license fee that comes with that as well too, specifically around the use of the dashboard as well. So if you wanted to discuss this around that, more than happy to do that. We have onboarded some 2,000 plus agencies, as I mentioned in the last few weeks, just alone, and then probably double or triple that since the start of this year around their COVID safe plans as well too. So there is a large volume of agencies that continue to use the dashboard and have actually got significant benefit out of this as well too from their monitoring and surveillance as well. We will open up the phone lines and stay on the line and answer any questions that people might have. If you are watching this webinar as a recording, thank you for joining us today. You can reach us on 1300 360 360 or email us at support@gemba360.com.